Judith Samuels is a research scientist who is also the lead author of Toolkit for Modifying Evidence-Based Practice to Increase Cultural Competence.
I made a statement during the last session that there have been some studies that looked at whether or not clinicians actually use the knowledge and skills that they've learned in school in using cultural competence in their practice, and how well do they do that, and the studies show that it's pretty dismal. Within the toolkit, the first section that we have in the introduction, it talks a lot about the evolution of the toolkit, how we came up with it, what it's to be used for, how to decide if your organization wants to use it. The interesting thing I think about it is that we did not do this based on all new information. We decided when we started this work that we wanted to sit down first and think really hard about who already knew how to do it, and we would just steal all their ideas and put them in one place. And that's essentially what we did. The goals of working with communities are not only to increase knowledge about the cultural groups and their mental health needs within your organization, but also to increase acceptance of services in that cultural group. And the way that we conceptualize it, community involvement very much hinges on the development of what we call a working group. Now, a working group in some circumstances could be just two people, but you really have to find a way to identify key people or people who are important to this clinical problem, to the cultural group, and the subpopulation, so it could be children or it could be seniors that you're working with, and people who are willing to work with you on actually doing the modification. So our conceptualization of how you modify an evidence-based practice is, since it didn't develop from the community, the practice, you have to engage the community in the process of actually doing the modification, and you use them throughout. And that their knowledge becomes very seeped in how you actually implement this practice. Another thing is that you want them to stay with you all the way through to the end when you're going to be working through implementation issues of getting this practice up and working. The third section of the toolkit, which is selecting an EBP, we had some discussion about, sort of how do you think about this. In the case of the Russian immigrants, the working group, we went online and started looking at a lot of these different registries, and they were specifically looking at interventions for depression for seniors. And they came up with 3 or 4 that they thought might be good or interesting. And then they came up with a review process where they looked through them, and they used, there's 2 very specific tools in the toolkit for evaluating cultural appropriateness of EVPs to see if they're a fit to a culture. One of them is from Kleinman et al., and you can see it in there. And the other one is called Human Concerns, as identified by Kluckholm. And both of these sets of questions and models are to help get at what are the cultural factors within this culture, and how do they relate to the actual workings of these interventions, to try to see if there's some match or some fit. For example, in worldview, if the worldview is completely different from one to the other. So for example, if the worldview is that, we view things as a collective, and the approach of the evidence-based practice is extremely individualistic, you may not decide that that's a good one. May not be a good match. So there are things like that are also in the toolkit. I'm not going through every one of them. Now, when it comes to modifying an evidence-based practice, does this look familiar to you? We decided that in order for our toolkit process to work across any type of intervention, we had to find a model that was universal, that could help us break down evidence-based practices into components that you could then consider for modification. When we think about modifying an evidence-based practice, we actually think about it in these pieces. We think about the pieces of the evidence-based practice that are engagement, the pieces of it that are work, and the pieces of it that have to do with termination and discharge. And if you read the manuals from many, many evidence-based practices like we did, you will see that all these pieces are in there. The next section of the toolkit is implementation issues. We talk about how important it is before you do something like this to evaluate your organizational readiness for change and your organization's current level of cultural competence. We have tools for that. We think that it's very important that an organization and people going to use the toolkit have some training in using it. We've been doing trainings, and we have recently put up online, free for anyone who's practicing in New York State, an online training course in the use of the toolkit through Essential Learning. We also discuss final implementation and what some specific issues related to that in the toolkit. We are building a learning community with a blog for anybody who uses the toolkit to, discuss with each other and help each other through the process. We have training and technical assistance available for use with the toolkit. I told you we have a second toolkit we're developing and the online training course. That's it. Thank you.
If you would like a copy of the toolkit, please click on the link below.